Dr. Michael Mitchell with Mitchell Dental is here with us again today, and today we're talking about TMJ, or difficult biting.
Right.
And tell me the stats again that you were just telling me, because it's a little more common than maybe I would have thought.
Right. Well, first of all, let's kind of talk about what TMJ is.
Okay.
TMJ stands for temporomandibular joint, and the TMJ, or temporomandibular joint, is a joint that sits just in front of your ear. Mm-hmm. This joint is different than any other joint in your body, and why dentists are concerned or help treat problems with TMJ is the only thing that really determines joint position is your bite. There are probably 90% of us that have some imbalance in our bite, and maybe a less than perfect alignment of the joint and the joint space. Most of us accommodate for that discrepancy over time, but about a third of the population will have some TMJ issue, which can be pain in the joint on opening or closing, clicking or popping in the joint, headaches in the temple area behind your ear to your neck, or feel like you lose your bite. Your teeth aren't coming together as they once did. Mm-hmm. So out of that third, 30% of the population that has a discrepancy or has wear of the joint, about a third of those will have symptoms of a point that may require treatment.
Okay.
So treatment can be as simple as, it kind of depends upon the cause. The cause, again, can be related to the bite, or trauma can also cause problems with the joint. For example, a whiplash-type injury, you get a dislocation of the jaw, tearing of the ligaments in the joint, and sometimes a displacement of the disc that sits over the head of the joint.
And what would the treatment options be?
So, if it's the first time that a patient has had symptoms, usually we recommend something conservative, just to rest the jaw, stay away from chewy foods, a softer diet, an anti-inflammatory like ibuprofen, and just kind of rest the joint and use the anti-inflammatory and see if the symptoms resolve on their own. If symptoms are persisting, then there are different types of treatment. In our office, what we do is some testing to determine how much wear has occurred in the joint on either side, and where the proper position of the joint should be. And after we get that information, then we make an appliance called an orthotic. It's a clear acrylic appliance. The size and thickness is determined by the position we've determined is appropriate for the joint. And so we have the patient wear that till symptoms are resolved, and then we start reducing wear time to perhaps maybe they just wear it at night as a protective device for the joint.
Will it actually move something in there to help relieve?
Well, what it does is when the appliance is in place, it lines the joint up. If the disc in the joint is displaced, it will hold the joint in a proper position to hopefully allow the disc to replace. It takes the stress off the muscles and ligaments so that they can relax. And as that occurs, then that relieves the symptoms that the patient has.
Okay, so if somebody has those symptoms that you listed, can they ask their dentist, and
Sure,
the dentist
certainly
can figure out if that's what it is?
It's always good, especially frequent headaches that are unexplained. If you've seen your physician, and they're not finding other causes for the headaches, or you feel like you're having frequent earaches, and maybe you've seen your physician again, or ENT, and they're not finding other possible reasons for the earaches, then the other option would be to see your dentist and see if it could be related to the joint.
Okay, great. Well, that's interesting. I didn't know that. There might be people out there with those symptoms that
Sure.
didn't know what was causing them. So great. All right, Dr. Mitchell, thank you.